My name is Connor Howes, and today I'll be completing ACVN Practical Assessment 10 Instrument Processing, and I'm currently here in the surgical suite where we have finished the surgical procedure, and we are just about to transport the kit from surgery into the processing area here. Before we have begun, I have washed my hands thoroughly with hot soapy water for at least 20 seconds, and I've applied minimal PPE, including disposable gloves and masks. This is because I'll be handling a corrosive chemical. It may cause burns or irritations to my hands. I'm also handling bodily fluids as well, so we don't want to get them onto our exposed skin and cause any areas of infection or contamination from the surgical site. So let's begin. I'll just transport this now. And we transport the kit on a trolley because there is less chance of the processing area becoming contaminated. It prevents accidental damage or droppage of instruments that may occur by lifting and carrying the kit up. It ensures risk of injuries don't occur. So now we want to make up the solution. Here we use liquid pyrol. So it needs to be a dilution rate of 2 mils to 2 litres of water. And we have already marked a line here which has been measured for 2 litres. So now we want to turn on the tap and we want to let that run until it is warm water. It must be warm water, so it's still just heating up there. Now, because we don't have the dosing cap, we transfer it into a smaller specimen container here, and we use a sterile syringe prepared, and we draw to the 2 litre line. And we want to draw to the 2 milliliter line. So we've got 2 mils of solution, pop that one straight in, and we'll fill up that now to the 2 litre mark on the instrument bucket. Again, it must be warm water for the enzymatic cleaner to work, as too cold and the lipids will begin to form, and too hot and the instruments can begin to break down and it can actually harm the instrument. So we're getting there now. Great. And that is 2 litres all full there. It is very important that the dilution rates are correct as per the manufacturer's instructions, because this means that the disinfection will work. If the dilution rates are incorrect, the disinfection process may not work and the instruments may still be dirty from the previous surgery. Also, with the enzymatic cleaner, it is very important that it is low foaming and a non-abrasive liquid, so it doesn't cause any harm to the surgical instruments whilst we are cleaning them. Okay, so now we want to begin by sorting the kit. I've already removed the scalpel blade by placing it into a scalpel handle holder and removing it into the sharps container. So I've already sorted that one there. We've got our suture needles here, which will need to be removed and put onto a fresh, clean swab, as this one has already become soiled. So we'll put those to the side. So now, when sorting the kit, we want to make sure that all of the instruments are open, all of the ratchets are unlocked, and all the box locks are exposed. We want to be handling them by the handles only, not by the sharp points, and placing them in open into the instrument solution. You also want to make sure that all of the instruments are fully submerged within the instrument solution for a 10-minute contact time. This is as per the manufacturer's instructions, and it is highly important that these dilution rates are met to ensure that the instruments have been properly exposed to the chemical so they can be clean. Here we have a bone chuck, which has been broken into 2 different pieces. We have the handle here and we have the screw top here. It also gets submerged into the same instrument solution here. So we'll do that, making sure that it is completely below the surface and none of the contaminants are becoming airborne. Now, we have our lumen instrument here. It is very important that both the interior and exterior of the lumen instrument is cleaned fully. So now it can be placed in the same instrument solution as well. We'll keep that fully submerged and we'll leave that for a 10-minute contact time. We now remove the linen drape here, and that'll be placed into a bucket of hot soapy water with the surgical drapes so they can soak prior to being cleaned for the drape wash. So now we'll transfer the trolley back in. Our processing area is very small, as you can see. We have our instrument solution there, our instrument solution with our instruments filled in there with waiting to be cleaned. We have our distilled water here in a small little tub, and then we also have a clean puppy pad which it gets placed on prior to drying. So now we have correctly submerged the instruments in the instrument solution for a 10-minute contact time as per the manufacturer's instructions. So it is very important that we handle all of these instruments with care. This maintains care and longevity of the instruments and also helps to prevent damage from occurring, also reducing droppage and maintaining their life. So let's begin now. They've been submerged and we scrub them under the water to ensure the contaminants are not being airborne. We want to make sure that all surfaces are clean and inspected for bioburden. They must all be opened up when displayed for drying. And some hemostat, so we want to make sure that we're getting all the serrations, all the hooks. We're not handling them by the tip, we're handling them by the rings. You're getting into the ratchets. And we want to rinse that with distilled water. This is very important because this removes all of the soap suds that may still be lingering on the instrument, all of the residue. And rinsing with water also leaves water deposits, which isn't the best for cleaning sterile instruments. You don't want to leave water spots. So now with the scissors, I want to make sure that they are scrubbed. I'm getting the box blocks. It's a bit difficult that I'm just by myself and I'm having to film this, and I apologize that you can't see in the video, but we are getting right at the tips, we are getting the rings, we are getting the box locks, we are getting the serrations, and then it is coming into the distilled water bucket here. And it is being rinsed. There. So now, the appropriate 10-minute contact time has occurred for the bone chuck. So now we will scrub it here. We want to make sure that we are getting the handle, we are holding it by the handle, and we are scrubbing every part of it. So getting right into the nooks and crannies, right into the bolt there. Want to get really into all of it. Make sure that it is well scrubbed, no foreign matter and no foreign debris remains. And now we want to rinse it in the distilled water to remove any excess residue. That one then gets there to dry. Now we have the lumen instrument here. We want to scrub both the interior of the lumen instrument, making sure that no gross contamination, no condensation, no water drops remain. And then we want to get our pipette here. We want to suck up some of the instrument solution as such, and we want to flush it through the lumen instrument. This makes sure that the interior is completely clean and no chemical remains inside of the lumen instrument. Again, as with anything, it all gets rinsed with the distilled water and set aside to dry. Now we'll be drying the surgical instruments. It's very important that we use a non-lint cloth to reduce any hair, lint, and bacteria that may fall onto the instruments while drying them. It is best not to let them air dry, as water spots can still form on the instruments. We want to make sure that we are drying the entire instrument. So getting it right into the tip, right into the serrations here, into the box lock, right at the handle and the rings. And then as per our clinic policy, our clean surgical instruments get placed into a clean kidney dish, which then gets set aside for processing and wrapping once they are all been dried and cleaned. So now I'm just getting right into the box here, removing all water spots and water residue, making sure that they're completely dry. Instruments can also be dried in the residual heat of the autoclave as well, if that's applicable. However, our clinic usually only has the ability to hand dry them. The lumen can actually be left to drip dry as well, just because the interior here won't be fully clean unless it stays out overnight or hangs from a height to let that water or that condensation fall out of it. So I just wipe the outside here. Now we have successfully dried all of the equipment, and now we'll set them aside for processing, wrapping, and autoclaving, and we will inspect the instruments now. So we have correctly cleaned and dried the kit now. I have discarded my mask and I put on a fresh pair of disposable gloves while we are inspecting the kit. So I have laid out the kit completely on a linen drape. I have lint rolled that drape so it is completely clean. I've got some swabs here to inspect for the sharpness of the scissors. And now we want to be inspecting for cleanliness, dryness, completeness, and functionality of the instruments. Are they all functional? Are they opening and closing very easily? Is the ratchet or the box lock getting stuck at all? You're looking for any water spots. You also want to see if any chemical residue has been left over, because that should be completely removed from the distilled water rinse. Great. Come over here. So there is a little bit of corrosion there, so I will advise the veterinarian as well, and maybe we could get a new surgical kit, and this maybe could become our spares as well. So we're just inspecting the kit there. We do use color-coded tape to identify our specific surgical kits. I understand that is not advisable, as the color-coded tape can become brittle in the autoclave over many cycles, and it also can harbor bacteria. However, as per our clinic policy, this is how we check that all of the instruments are correct for that appropriate kit. Great, so I'm checking here now with the hemostats and the needle drivers. You want to make sure that they're completely aligned. No light is coming through. They are all opening and closing appropriately, and they're not loose at all in a closed position. So again, I'm checking all of these. Fantastic, that's all looking great. They're all looking perfectly dry and clean. You want to make sure that no light is coming through, that they are opening and closing appropriately. The ratchet of the box lock is not getting stuck at all, and the joint should not be loose in any way. Now you want to be checking the forceps here. You want to make sure that they are meeting appropriately in the middle. They're not bent, they're not damaged, they haven't been dropped. There is a little bit of corrosion and pitting on that one there. So again, I will advise the vet that the rat tooth forceps does have some pitting. So we do have another pair of scissors here, so I'll just double check them, checking for dryness, completeness, opening and closing 3 times. It is smooth, it is not getting stuck in any way. We are testing for sharpness, just on a swab, or gauze swab here. Great, they're not loose at all. It is cutting perfectly. It is free from nicks and chips, and they are not catching when they are closing, so I am very happy with that. Now, it is very important that we lubricate instruments in between surgical procedures and patients. So this can be done with a spray on lubricant oil, or it can be done in a milk bath, such as Surgislit or Microlube. So they would be placed into the ultrasonic cleaner. Then when they come out of it, they would then be put into the instrument bath and then let to dry. Lubricating instruments is very important, as it keeps hinges and ratchets functioning properly and keeps instruments working in a correct working condition. But other than that, that is everything today. That is Practical Assessment 10, Instrument Processing.